Carpal spasm when the upper arm is compressed to cause ischemia to the nerves distally. Option A, Homan sign. Option B, Trousseau sign. Option C, Vostick sign. Option D, Kernig sign. The answer is option B, Trousseau sign. Homan signs test, also called dorsiflexion sign test, is a physical examination procedure that is used to test for deep vein thrombosis. Technique. In this test, patient will need to actively extend his knee. Once extend the knee, the examiner passively and abruptly dorsiflexes the foot and squeezes the calf with other hand. Deep calf pain and tenderness may cause indicate presence of DVT. Trousseau sign performed to test the possibility of hypocalcemia. Place the sphygmomanometer cuff around the arm, slowly inflate cuff up to 20 mm of Hg and wait for 2 to 3 minutes. A positive sign characterized by the appearance of carpopedal spasm which involve flexion of wrist and thumb. Vostick sign is a clinical finding associated with hypocalcemia. The sign refers to twitch of the facial muscle that occur when gently tapping the individual cheek in front of the ear. The Vostick test aims to check the atypical reaction of facial nerve, the nerve that innervates many of the muscle of the face. The pressure caused by the tapping acts as a triggering stimulus for involuntary contraction of the facial muscle ipsilaterally that the clinical sign is performed. The sign is considered negative when no contraction of facial muscle occur after stimulation of the facial nerve. Kernig sign. Kernig sign is one of the clinical signs of the meningitis. Severe stiffness of the hamstring causes an inability to straighten the leg when hip is flexed to 90 degrees. Next question. Rapid speech in which words are strung together without any meaning. Option A, word salad. Option B, flight of ideas. Option C, echopraxia. Option D, echolalia. The answer is option A, word salad. Word salad is otherwise called schizophasia. Flight of ideas. Flight of ideas is a continuous flow of speech in which the person jumps rapidly from one topic to another. Echolalia is a psychiatric disorder that makes someone meaninglessly repeat what other person says. Echopraxia. Echopraxia is a tic characterized by the involuntary repetition of another person's behavior or movements. Next question. A condition of pancreatic tumor causing excessive outpouring of gastric juice is option A, dumping syndrome. Option B, Ehlers tumor. Option C, Zollinger-Ellison syndrome. Option D, none of these. The answer is Zollinger-Ellison syndrome. Zollinger-Ellison syndrome is a rare condition in which one or more tumors form in pancreas or duodenum. This tumor is called gastrinomas. Gastrinomas secrete large amount of the hormone called gastrin, which causes stomach to produce too much hydrochloric acid. This leads to peptic ulcer. Dumping syndrome. Dumping syndrome, also called rapid gastric emptying, occur when food moves too fast from the stomach to the duodenum. Gastrectomy is the main cause of the dumping syndrome. Highest level of need according of Maslow's hierarchy is option A, safety. Option B, physiological need. Option C, self-actualization. Option D, love and belonging. The answer is option C, self-actualization. There are 5 levels in Maslow's hierarchy of needs. Maslow's hierarchy of needs is a charted set of human requirements that are important for an individual to achieve complete development and self-actualization. Hierarchy of need is a theory developed by psychologist Abraham Maslow. The level of hierarchy starting from base of the pyramid are physiological needs. These are biological requirements for human survival. Example: air, food, water, shelter, clothing, warmth, sex and sleep. Second is the safety needs, protection. Example, protection from order and law. Next is love and belonging needs, involving the desire for interpersonal relationship and being a part of group. Example, friendship, intimacy, acceptance, receiving and giving affection and love. Next is esteem needs, classified into two needs, desire and self-esteem. Self-esteem stemming from the dignity, achievement, mastery and independence. Desire for reputation or respect from others, including status and prestige. Next question. Implicit model is for option A sex therapy, B behavioral therapy, option C family therapy, option C spiritual therapy. The answer is option A sex therapy. Implicit model, also known as the implicit model of sex therapy, is a modeling system used in the field of sexology to determine the different level of intervention for individual clients. The model was developed by Jacques Anand. The letter of the name refers to the four levels of intervention that a sexologist can apply. P stands for permission, LI stands for limited information, SS stands for specific suggestion, and IT stands for intensive therapy. Next question. Solution used for bladder irrigation for a patient undergoing transurethral resection of prostate or TURP. Option A glycine, option B NS, option C ringer lactate, option D isolate B. The answer is option A glycine. 1.5% glycine irrigation is a sterile, non-pyrogenic, non-hemolytic, non-electrolytic, very weakly ionized solution. Each liter contains 15 gram glycine. The famous 14 principle of management was first defined by option A Elton Mayo, B Henry Fayol, option C Adam Smith, option D James Watt. The answer is option B Henry Fayol. Henry Fayol, known as father of modern management theory, gave a new perception of concept of management. 14 principles of management created by Henry Fayol are division of work, authority and responsibility, discipline, unit of command, unit of direction, subordination of individual interest, remuneration, centralization, scalar chain, order, equity, stability, initiative, and a spirit D corp. Scientific management theory was developed by option A Max Weller, option B Frederick Taylor, option C Adam Smith, option D James Watt. The answer is option B Frederick Taylor. Next question. Which of the following characteristics is not related to laissez-faire leadership? Option A very little guidance from leader. Option B complete freedom for followers to make decisions. Option C leaders provide the tools and resources needed. Option D there is little time for group discussion making.
Answer is option D.
There is a little time for group decision making. Characteristics of laissez-faire leader. Little guidance from leader. Employees have the ability to make decisions. People are expected to solve their own problems. Access to many resources and tools. Constructive criticism from leaders. Leaders take charge when necessary. Leaders take responsibility for overall actions and decisions. Next question. Hygiene factor and motivation factor are key concepts in option A Maslow hierarchy of needs, option B expectancy theory, option C goal setting theory, option C goal setting theory, option D Herzberg's two-factor theory. The answer is option D Herzberg's two-factor theory. Two-factor motivational theory, otherwise known as Herzberg's motivational hygiene theory. Two-factor theory states are certain factors in the workplace that cause job activation, while a separate set of factors cause dissatisfaction. Husband's two-factor theory of motivation is based on two types of factors. Factors are satisfies or motivation and dissatisfy or maintenance or hygiene. Hygiene. This factor has affected to reduce motivate workers. The hygiene factor affects the condition of workplaces. If the hygiene in the area is not adequate, the workers might not want to work. Hygiene factor include pay, company policy, work condition, interpersonal relationship. Motivation, a sense of achievement, meaning employees well know that because of their hard work, the business is going forward. Recognition of workers' contribution, the owner will give credit to workers, making them feel good about themselves. Motivational factors are achievement, recognition, interesting work, increasing responsibility, and growth. Haswell's theory argues that the nature of people to take credit for satisfaction and blame dissatisfaction on external factor. Next question. Board committee is also known as option A, Health Survey and Development Committee, option B, Health Survey and Planning Committee, option C, Hospital Review Committee, option D, Modelier Committee. The answer is option A, Health Survey and Development Committee. The Board Committee or Health Survey Committee and Development Committee was appointed by the Government of India in October 1942 to assess the health condition and services in India. Its chairman was Joseph William Ball. The following is a Indian Health Care Accreditation Agency. Option A, Joint Commission International. Option A, Joint Commission on Accreditation of Healthcare. Option C, National Accreditation Board for Hospital and Healthcare Providers. Internal Society for Quality in Healthcare. The answer is National Accreditation Board for Hospital and Healthcare Providers, or NABH. In material management, the period in days that elapse between placing an order and receiving the stores is termed as option A, lead time, option B, economic order quality, option C, quantity survey, option D, reorder time. The answer is option A, lead time. A clinical judgment about an individual, a family, or community responses to actual and potential health problem refers to option A, system analysis, option B, outcome identification, option C, nursing diagnosis, option D, quality assurance. Answer is option C, nursing diagnosis.